Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. Myself is Professor Deshpande. I am MD in Ayurvedic medicine and MD in Ayurvedic physiology, that is Kaya Chikitsa and Kriya Sharir. We are making the series or the serial that is Ayurveda in GP or Ayurveda in general medical practice. For paid online consultation, you are always welcome. With my team members, I have a lot of expert doctors with me. You can WhatsApp me on 9226810630. This is given in the description also. Today we are going to discuss the nearly 5 or 6 things regarding the kidney. Kidney problems are also called as renal problems, and most of the people are afraid of the getting chronic renal failure or called as a chronic kidney disease, CKD. So many people ask me, sir, are you treating this and this and that? I have the separate video made on this chronic kidney failure, so you can see that particular video. But yes, our team is always trying our level best to treat with the Ayurveda to avoid the dialysis and all these things. But this has a limitation with the patient response. But forget about those complicated things. Renal or the kidney problems are why serious? Because there are some important organs in our body. For example, heart is very important because it is giving the blood supply to all the organs. Then liver is important because that is the biggest factory in our, which makes the protein, carbohydrate, fat metabolic process. Brain is very important because it is controlling, accepting the senses and controlling our hands and leg movements and all these things. This is the best part, which is a like a king. But before that, we should not neglect the toilet in our house. So what is the toilet in our house? Yes, I am saying, as in our house, our dining hall is important, kitchen is important, then the worshiping place is important. Similarly, toilets are important because if it is blocked, you know how problematic is the whole house becomes. So even if you are living in the palace, their palace should have the proper toilet. Similarly, in our body, kidney is functioning like toilet. Whichever the waste products that are developed in the protein, carbohydrate, fat metabolism, they are excreted through the kidney. And that particular kidney, if it is affected by infection or autoimmune cause or whatsoever causes, or the stone, then it can be a very, very big problem for our whole body. Because of only kidney failure, urea is one of the important and toxic waste product. If it is not eliminated from the body, that it accumulates in the blood, and that particular condition is called as a uremia. Amia is a blood, so urea is accumulated in the blood that can make the patient unconscious, and if not treated very actively and properly, then the person can die. So because of the kidney, you have the one has to take a lot of problems, economical, physical, psychological, and all these things. So let us discuss some of the important problems apart from that chronic kidney disease, because that I have made a separate video. You can check that particular video, what I have told about Ayurvedic management of the chronic kidney disease. Now, the common GP problems, I am talking about not hospital, of the GP level: acute pyelonephritis. Pyelo means pus, and acute means immediately within a period of 2, 4, 5, 6 days, once within a week period. But if it is a month's duration, from the 6th month, from the 4th month, I have this problem that is called as a chronic pyelonephritis. Acute glomerulonephritis, this is autoimmune disease, and chronic glomerulonephritis, there is the inflammation to the kidney cells. Then kidney or ureteric stone means calculus. I have also separate video on this calculus. Even some of the medicines that I have discussed separately, for example, if I remember properly, cystone tablet, which was very popular video amongst us. So you can also look for the cystone drug review particular video, which is fantastic tablet for the ureteric stone. Then hematuria, blood in the urine, that is also one of the important thing. Okay, let us start with discuss one by one problem. First is a acute pyelonephritis problem. So first we will discuss about the causes. Infection of the kidney by bacteria is called as a nephritis, inflammation by the pus, or pus is there. Age and sex: higher incidence of acute pyelonephritis during the first 8 months of life due to the fecal soiling of urethral meatus. Because in the children, if the proper care is not taken, that soiling means the fecal is making urethral contamination, and urethra is a source of infection to the kidney. 10 times more common in the females. This case is another. Infant is another. Then we are talking about females. during the childbearing age due to the sexual trauma or and pregnancy. That means during the pregnancy, there are a lot of chances to get infected because of the, again, structural problem. In the females, the urethra is very small. And also there are three openings like vaginal opening, urethral opening, and also the opening, anal opening. So as these openings are very near to each other, any irritation amongst the particular these organs can make a person to be get infected. Then predisposing factors, obstruction. There may be strictures in the urethra. There may be calculus in the whole urinary tract, like kidney, ureters, then bladder, and then the urethra. These are the structures, you know. Foreign bodies, phimosis. Phimosis is a condition where the skin on the penis, which is not properly moved front and back, and then if it is stuck up in the front, that is called as a phimosis. If that skin is stuck at the back, that is called as a paraphimosis. Okay, neurogenic bladder, renal diseases like nephritis or renal tuberculosis. Remember, TB is not only with the chest. TB can affect any of your body parts, like for example, bones, that is a Pott's disease in the vertebral column. Then even the ileocecal junction in the abdomen, that is affected. Then kidney can be affected by tuberculosis. Trauma, injury, catheter, instrumentation, and surgery. Ischemia is a less blood supply, either caused by local events or in the association with hypertension or aging. Now, what you can do to find out the urine problem? Most of the kidney diseases, they give a typical type of swelling that is called as a periorbital swelling around the eyes. Around the eyes, edema or the swelling is called as a periorbital swelling, which is in the morning. This is a typical feature that indicates that your kidney is having some problem. Periorbital swelling, not because of the eye problem. I'm not discussing eye problem. Without any eye problem, no redness, no watering, no itching, but only around the eyes there is a swelling in the morning. That is a typical feature of the kidney problem. Don't forget that. Urine albumin, you have to check in the laboratory. Urine albumin will be too much, 2+. Pus cells will be 3+, and RBCs will be also present. Rule out the mechanical obstruction like stricture or stone. You have to treat by surgery. If yes, remove it first, and then you can give the typical Ayurvedic good medicines, like for example, Chandraprabha tablet, very specific for genitourinary problems, 2 tablets 3 times in a day. Sukshma Triphala, Ayurvedic type of antibiotic, 2 tablets 3 times in a day. Then Varunadi Kvath, 4 teaspoon with equal amount of water, 2 times in a day, especially with the stone. Another prescription for pyelonephritis. Second prescription, my dear friends, Gokshuradi Gugulu, 2 tablets 3 times in a day, plus Shothari Loh, 2 tablets 3 times in a day. This is also common that in the kidney diseases, especially chronic kidney problem, always gives the anemia, because kidney is secreting erythropoietin local hormone, which is essential for the formation of red blood cells. And that erythropoietin from the kidney is get less because of the kidney problem. So whenever there is anemia and kidney problem, Shothari Loh, Shoth is edema, that will reduce the edema. Then Arvindasav, inflammation, Pitta problem. ITS is inflammation. This is a cooling Pittagna Dravya, 4 teaspoon with equal amount of water 3 times in a day. Ushirasav is also cooling agent, reducing the Pitta inflammation. Ushirasav, 4 teaspoon with equal amount of water 3 times in a day. Then drink plenty of water and continue the treatment till it gets complete cure. Now we will discuss about the chronic pyelonephritis for the month 2, 3, 4 month history due to the bacteria, but could be secondary to diabetes. Remember, whenever the patient of kidney comes to you, don't forget to check whether the patient is diabetic or not. If you don't have any perfect reports, then do it fasting and post glucose blood sugar or glycosylated hemoglobin and confirm that. Prolonged consumption of common analgesics, very, very important. Aspirin and other conditions. If especially the people are taking migraine and lot of Combiflam every month, they are taking nearly 7-8 days and months together, that can damage your kidney. So many medicines, if taken without doctor's prescription for a longer duration, even Ayurvedic medicines, even the casual, because of the economical problem, taking the very casual company, this Ayurvedic medicine, that can give the very dangerous side effects because of the metallic preparation. So always buy like a company from Baidyanath, Dhutapapeshwar, Jhandu, Sandu, and all this reputed company, Ayurveda Shala Pune. So you have Himalaya. So bring the products from the standard Ayurvedic pharmaceutical companies. Otherwise, you will suffer maybe from allopathic medicines or maybe from the Ayurvedic medicines. You have to do the urine fair number of pus cells with RBCs, urine culture. If it is infection, always do the culture and sensitivity test. Which organisms and which antibiotic is the best? That is must be seen. Blood urea level to test the kidney function. Urea and creatinine. Urea and creatinine blood tests are very important for all kidney diseases. Urine examination is must for kidney diseases. Blood sugar level, fasting and PP to rule out the controlled diabetes. Then you have to give this treatment. Tablets is stone, Himalaya company, 2 tablets 3 times in a day. Sukshma Triphala, 2 tablets 3 times in a day. Punarnavaso, 4 teaspoons with equal amount of water, 2 times in a day. Now we will discuss autoimmune diseases, which is the acute glomerulonephritis. Age most common in the childhood, in between 5 to 10 years of age, more in the male baby or male child. Infecting organisms, beta hemolytic streptococcus. Site of infection, usually it starts in the throat or the skin because of the tonsillitis, pharyngitis, laryngitis, or skin infection like scabies impetigo furunculosis. Interval between infection and onset. You had a history. You have to discuss with the patient's parents, children, from where, how was the started. Then they says 1 month back, 3 weeks back, there was a respiratory infection, and then he started the urinary symptoms or edema over here. So that can be the basic cause of that problem. Then immunity, inflammation and coagulation will all play a part in the pathogenesis of glomerulonephritis. Now we will see what to do in the investigation part of the acute glomerulonephritis. Urine, you will see the volume is always reduced in 24 hours. Dark color or the smoky color, when fresh, there will be albuminuria or the protein in the urine. RBCs will be more in number with red cell cast or granular cast. These casts are very specific of glomerulonephritis. My dear doctor friends, you must remember this cast word for the diagnosing of the nephritis patients. Hemogram and ESR, you will get the neutrophil count more. That is called as a polymorphonuclear leukocytosis. WBCs are more, which are the fighting cells. Raised ESR because it is a chronic infection. Chronic infection gives always erythrocyte redimentation rate high. ASO titer, anti-streptolysin O titer to rule out the upper respiratory tract infection or the streptococcal infection. It will be high titer, 1:3000. Blood urea and blood creatinine level will be also raised because of the kidney problem. Now, what to do and how to treat that particular glomerulonephritis? Let us see. Bangashila tablet from Allersin company, 2 tablets 3 times in a day. Punarnavasa, which is a diuretic and also regenerative. Punarnava, damaged kidney cells will be regenerated because of the Punarnava. This is the name of the plant. 4 teaspoons with equal amount of water 2 times a day before meals. Pathya, always keep urine input and output chart for the patient, especially this is for doctor. Give the patient half liter of extra water than the output of urine on the previous day. Even you can ask that bring the measuring cylinder to the parents or the relatives of that particular patient, and they can measure the urine at their home also, and keeping the record on the paper and show it to the doctor next day. Strict bed rest is essential. Eggs, non-veg, legumes should be stopped because protein metabolism and the urea is not excreted properly. Urea is a waste product of protein metabolism, and these are all proteins. Okay, salt should be in moderation. Mung beans, that is a green gram, jowar roti, leafy vegetables are the best, and milk diet is also advisable. Next, we will go for chronic glomerulonephritis. First, we discussed about the causes and the investigation. So these are the causes. Most occur at any age, but mainly in the males. Follow an attack of the acute glomerulonephritis or present without previously known or recognized acute glomerulonephritis. So this is a chronic variety of glomerulonephritis. Recurrent exacerbation of hematuria, blood in the urine, this will be the complaint. And hypertension, remember, these two things are very important in the kidney problem. There will be blood in the urine or there may be also hypertension. With wide fluctuation in the blood urea suggest increasing likelihood of developing persistent glomerulonephritis. So you can do the urine specific gravity. It will be around 1.010. Microscopic hematuria will be there, and granular cast. Always cast is a word for the nephritis. Blood urea gradually raising, the rise being associated with increasing acidosis. Now treatment, what you can do? You can do the Urocept tablet from Sandu company, 2 tablets 3 times in a day. Then Gokshuradi Gugulu, 2 tablets 3 times in a day with, you can see, Tuna Punchamulakvat for 1 month, 4 teaspoons with equal amount of water. Then Vakeri Loh, again from the Sandu company, 2 tablets 3 times in a day. Now, the treatment will be same as acute glomerulonephritis. About the kidney and ureteric colic, we have the different video. When we discuss the pain in abdomen, that video we will cover the ureteric colic. But still, at this moment also, there is another video that I have made about the tablet cystone. Don't forget to see that particular video. Now we will discuss about hematuria, that is the blood in the urine. What are the causes? Common causes are kidney and ureteric stones. Then in acute glomerulonephritis, there may be blood in the urine. Rare cases are cancer of the kidney or the cancer of the urinary bladder and diseases of the prostate also. In the male patient, benign prostatic hypertrophy or prostate cancer is very common. Now, investigations, what you can do? Urine routine examination. Always, whenever kidney problem, do the urine routine. Plain X-ray abdomen, AP and lateral. Abdominal sonography is must. IVP, intravenous pyrography for the stone in the kidney, ureter and bladder, KUB. VDRL to check the venereal disease or sexually transmitted diseases like gonorrhea, which can cause the urinary tract infection, gonorrhea, and that can go to the kidney and can cause the chronic pyelonephritis type of symptoms. HIV, PR, per rectal examination for prostatic enlargement. Now we will go for the treatment part. In Ayurveda, it can be compared with the Rakta Pitta Vyadhi, Rakta Pitta, bleeding disorders. Whenever there is excessive Pitta Prakopa, it can damage to the Rakta Dhatu and it will start the fragility of the capillaries. So in these all patients of any bleeding, you must avoid the Pitta Prakopak Ahar Vihar. Pitta is a Ushna Tikshna property, so don't take any hot, spicy, pungent food and beverages. Never, no excessive pungent chili type of substances, then hot tea, hot coffee, alcohol, smoking, keeping late at night, increased screen time. These all the things are avoided in this hematuria patient. Tablet Stiplon, hemostatic tablet from Himalaya company, 2 tablets 3 times in a day. Chandra Prabha, a best tonic for the whole our genitourinary system, 2 tablets 3 times in a day. Ushirasava, Pitta Ghna, anti-pitta type of medicine, 4 teaspoons with equal amount of water 2 times in a day. Chandanasav, Chandana, sandalwood, 4 teaspoons with equal amount of water 2 times in a day. Another prescription for the hematuria, blood in the urine, Chandra Kalarasa, 2 tablets 3 times in a day. Gokshuradi Gugulu, 2 tablets 3 times in a day. Godanti Bhasma, Pravat Bhasma, 2 tablets 3 times in a day. And Bola Baddharasa, 1 tablet 3 times in a day. My dear friends, Pitta is very important and we have to give the anti-Pitta medicines for the any Rakta Pitta Vyadhi. That is, for example, here we are talking about the hematuria. So my dear friends, in this particular video, Dr. Deshpande has tried to make you aware of the kidney problem and how your kidneys are very, very important. So please do take care of the kidney. How you can take the care? Navegandharayet vata vinmutra kshavatruchudam. Ayurveda says urine sensation should not be avoided. Remember this thing. Whenever you feel to go to the urine, go to the urine. Then whenever you have the fever with rigor, it may be because of 2 reasons, malaria or the urinary tract infection. First, immediately check the urine, whether there are pus cells, whether there is albumin, whether there is any sugar, whether you are diabetic. Check it, all these things. This can prevent your kidney. If you have the diabetes, no problem. If you have the BP, no problem. But make it a control. Under control is no problem. But if you are not bothering about patya and your blood sugar is going high, that can make the diabetic, what you can say, the diabetic, this particular called as a renal pathology. So that your kidney should be protected from these another elements also. Navegandhare drink enough amount of water, especially in the summer season. For example, the simple sharbat, what you say, lemon juice, or the fruit juices, they are very important. But again, drinking enough water doesn't mean that too excess water or too low water. Again, also you can take the precaution whenever there is edema around the eyes in the morning, go to the doctor immediately, don't make any delay. And whatever the medicines are suggested, especially for the urinary tract infection, they should not be stopped spontaneously. Within 1 or 2 days, you stop the fever and rigor, then your burning is stopped and you forget about the antibiotic course. This should not be done. 3, 5, 7, 10 days, whatever your doctor is telling, you should follow that antibiotic course. Check again urine. There should not be no pus cells, absolutely no pus cells. Again, do it after 1 month. See the urine, no pus cells. Then you can say that you are away from the kidney problem. Because many times that hidden sub-minimal level infection persists, and that is culminated into the serious kidney problem. So do not negligent about this particular infection problem, urinary infection, about the pus cells. You should be very careful. So drinking enough water, taking the precaution of food, not taking spicy and pungent food. And last but not least, any nephritis patient, if they are taking any steroids, especially Visolon and prednisolone tablet, that should be under the guidance of your physician or the nephrologist. Otherwise, that steroids is a good for the nephritis, but steroid is also bad for the other reasons. It has a lot of side effects. For example, it can create diabetes, it can create hypertension, it can create ulcer, it can create your bone weakness, osteopenia, osteoporosis. So be careful about Visolon and all these steroids. Of course, the doctor will guide you very properly. It should be stopped in a tapering manner. I wish that you should not get any kidney problem, but for this type of interesting knowledge, you requested to please subscribe my YouTube channel and take good care of all your body parts. Thank you very much. See you soon in the next video. Thank you. Take care.